We ask for your blessing and wisdom upon this Parliament. Direct and prosper the proceedings to the peace and welfare of the people of Solomon Islands. We ask this in the name of our Lord and Savior Jesus Christ. Amen.
Thank you. Parliament is to resume.
Bills Committee states the 2026 Appropriation Bill 2025.
Honourable members, the House will resolve into the Committee of Supply to continue consideration of the 2026 Appropriation Bill 2025. Thank you. The now sitting as a Committee of Supply. We are now in the Committee of Supply to consider the 2026 Appropriation Bill 2025. Honourable members, before we go into detail, perhaps I'd like to make a reference to some of the exchanges that we had on Friday, sitting about what approach should be by the Committee of Supply in the consideration of the budget. And I think it was initially through supposedly a point of order raised by the member for East Choiseul regarding my ruling on how the proceedings of the committee is to proceed vis-a-vis Standing Order 64.3 and Standing Order 69.1e. A few contributions were made by other members who also spoke on this matter. And although the rules governing the link between the PAC report and the Committee of Supply proceedings is clearly stated in the orders, the practice all along did not comply with the rules. Hence, attempt to align the practice with the rules. However, in hindsight, the PAC hearings did not fully dispense with the functions under Standing Order 69.1e. And the PAC report did not fully consider the proposed spending plans of the government, ministries and agencies as envisaged by that order. Hence, it would not be reasonable to totally rely on the PAC report in the Committee of Supply debate. Therefore, I rescind my earlier ruling and revert to the practice of focusing on the Committee of Supply debate on the draft estimates. This is a matter that must be reviewed to align the purpose of Standing Order 64.3 and 69.1e. Nevertheless, only policy matters should be the focus of the debate and not solely administrative or operational matters. That's the way forward I'm suggesting. And therefore, in the review of the standing orders, this has really need to be taken into account. But I'd like to refer also, perhaps it was distributed, you would have come across in the budget briefing by the FPO. This, unfortunately, was not tabled. If it had been tabled, the guidelines actually contained in this to align those. So we hope that this can be tabled and then in future make reference to the approach that is identified, and that will address the issues that we have been perhaps out of context with. I hope that the committee understands the position I'm coming from, the chair is coming from. But for today's, therefore, after my explanation here, today's approach would be we go by the bricks, but based on the pages, I'll call for a number of pages, but because there are big departments still coming up, and therefore not only the pages, but the departments or divisions in the administration. So if him say, okay, department, let's say the next one is health, the Ministry of Health. The approach would be for me to invite comments on the number of pages, where him cover them, specific departments in that head, so that we don't have to go page by page. We go by the department covered in the bricks estimates. I hope that's clear, because we only have 2 days, today and tomorrow, right? Under the standing orders again, only 4 days, okay? So we'll have to dispense it with this. I thank you, and that's the way to approach it now. Any comments on that before I dwell into this approach? Thank you. Honourable Leader of Opposition.
Hallelujah. We like to sing him, eh? Because if you tatalem osemba time you miss that, I think you finish him whole thing here now. But you like for go back here now, you meet carry him on, go kasim also.
Thank you. I'm applying the rules.
Because I'm applying from the start now, making him consistent. Government submit on time, PAC got 5-6 weeks to deal with it properly, and report come, here you may know West Time on PAC doing every work. PAC didn't do that because it didn't have the time. But we appreciate that clarity. Then next round you insist now, make him. You may everyone fall into time. Just on the FBO, sir, with the greatest of respect, but the FBO is not the PAC, and it's not understanding orders, and therefore that report should not be tabled, but it should support members in any case. So there's some good work that's been done there, but we mustn't equate it with the same level or same report block PAC. So we just need to make sure PAC has the time to do it work. So thank you for that clarity. We appreciate it. This time, I think no more lunch today, we finish the whole thing. It's clear good now. Thank you.
Thank you, Honourable MP for Small Malaita.
Thank you, Mr. Chairman. Me happy lo am no more is. Osem, imi go back, kakam back. Osem, but time you make it osem you do it, no? But you go forward. Make him 5 page one time. Osem, but this one you do him come here. By what man way you cover and finish, what ministries you cover and finish, by go by lo him one osem. Him let take a long time. So osem we stand up now for affirm him and agree with him when you talent chairman. But everything depends on you now. You not allow them to go back ma. You may go forward no ma. That one you low power for you. You point of order on League of Opposition, Chairman.
Thank you. Honourable MP for West Arad.
Thank you, Chairman. No listener to follow mania. Thank you for your indulgence. Me also happy, and a lot of wisdom has transpired over the last few days when we deal with this bricks, Mr. Chairman, and me appreciating that wisdom. Next one, we prepare for him now, because what you come up with him, that's orderly. And make him PAC to wakaya time he come no more, yes, go now. Having said that, Mr. Chairman, workflow this for Solomon Islands Pacific Floating Budget Office. Barakut wakaya, so Okata somehow should go in lo PAC so that Okata reporting and the information analytical analysis block and bara helpful time you read him and you look waiting PAC report. But I certainly appreciate that let's put PAC low work so that 4 weeks or 5 weeks of what to do and then what to fulfill him this will stand in order and Imiko. lastly, Chair, standing order outstanding lo yumi must still wait him. This sitting, Mr. Chairman, make himself a team now. Yumi going forward in those wisdom that he just wanted to guide us with, Chairman. Thank you very much.
Thank you. Honorable Prime Minister.
Thank you, Chairman, for on behalf of the government side for you accept him now. The wisdoms that Mifala put in for you to take him, and Mifala say thank you for that intervention. And Chairman, me agree on what leader of opposition telling for him complete him last time, him complete him now. Him say so. Me conquer that idea of leader of opposition, but me game you for you leading house for Mr. finishing the budget along time frame by himself for him. So thank you, Chairman.
Thank you, Honorable Deputy Prime Minister. So we'll move straight on to the its head based on the understanding that we have just shared. And our first head for consideration this morning is Head 08, Office of the Governor General. I refer to the bricks. There are only 1, 2, 3 pages. Any comments on those 3 pages? Sorry. I think the procedural again, apologies for the oversight, but Head 08, Office of the Governor General, here it is proposed that the sum of $11,570,680 for Head 08 stand part of the schedule. If any member wish to comment on the head, and the pages available here, pages 162, 162, 163, 3 pages in the BRICS report. Thank you. Any comments on that head? Thank you. I take it, sorry, Honourable Leader of Opposition.
Thank you, sir. Just two comments. One is just the surrounds below the property itself. And social bill not lohem around them the outside lohem nami. Say we do need the dignity of that office. Of course, is reflected by the occupant, but also by the the facilities and the surrounds of it. Making him look a little bit also me really respect him and value. So that's something that I mean not big something, but it does add up to what that office, how high we should hold that office. Question below me, I mean, you know, against not man bill not, but some tidy up a little bit. No, a central quack sem lala, you know who spoiling bill not. Question below me is with regards to travel, overseas travel. Below His Excellency, what plans now for 2026 for travel? Thank you.
Thank you, Honourable Minister of Finance, Minister for Travel by His Excellency. Can you specifically refer to that provision on the pages so that it helps the response?
Overseas accommodation, overseas other costs, and annual leave long in country no more, but overseas accommodation, overseas other costs, and point to travel. Thank you.
Thank you. Honourable Minister of Finance.
Thank you, Chair. Do thank the leader of official opposition for that important observation. I think, Chair, as you aware that if we coming to the area, especially the original plan, which to do with the resident of the government general, I should know the Wareham, but that's something we can look at going forward. But in terms of especially the environment around the current government house, through especially even along the road and even the surrounding which is even low value or low side, that's really a concern as well. So we are taking note on that to see how we can deal with that. In terms of the head in relation to the Governor General overseas travel, I think mainly you may aware that there's also some of the annual meetings that require the Governor General to attend, especially to do with when attending some ceremonies when in relation to the king. But the other thing mainly for is medical trip too, which is that of course sometimes even that the governor, the prime minister might not attend, probably, but not really clear schedule for the governor general for next year. But from practice and of course from actuals, that's a kind of figure reflecting the trips that the governor generals have taken. Thank you, Chair.
Thank you, Honourable Minister of Finance. Honourable Leader.
Thank you. I am aware that His Excellency has just had a medical trip overseas, and actually quite an extended one. So I doubt that. But you got a note from Office Floor Governor General? Note to you. Because it'd be good for PS Blohem to be here to support you in that. So because I know any planned trips, you may just provide them Selenoma just in case, or from what you're saying, it sounds like that.
Thank you, Honourable Minister of Finance.
Thank you, Chair. Yes, that's awesome. You may accommodate him now from what provided to the Governor General, especially from and the in practice in the past, they not fully utilize what English. So you will see, especially some decrease, of course, Lord Hedge because of that one. Thank you. Thank you.
Thank you. Honourable MP for West Harare.
Thank you, Chairman. Milo page 162, the accounting code 21291010840. This for sitting allowance. There was no expenditure law 2024 and 2025. Is it a new committee or that throws the budget for? The budget is for next year. Thank you, Chairman.
Thank you. Honourable Minister of Finance. Page 162. Accounting code 2130110108040. The new province sitting allowance, none for 24-25. It's a new one. So the question is, the sitting allowance is a new arrangement for 2026. That's the question.
Yes.
Honourable Minister of Finance.
Thank you, Chair. I think me trying to look at what actually the head on that Chair of BLC was raising. Thank you.
Can you repeat your comment, question?
Thank you, Chairman. Thank you, Minister. Page 162 had 2120910108040 sitting allowances. I was inquiring to, there was no budget in 2024 and 2025. Now there is a budget of 12,000. this is a new committee that draws this budget. Thank you, Chairman.
Thank you. Honourable Deputy Prime Minister.
Thank you, Chairman. And thank you, Chairman Longo Bills and Legislation for the question. So the sitting allowance is for the members of the committee on the prerogative of Messi and King's Birthday Committee sitting allowance. The previous years we have not captured. We captured longo various allowances, necessary longo code 2120410108040. I'm captured longo there. Thank you, Chairman.
Thank you, Honourable Prime Minister. If there are no further comments, I will not put the question. Sorry, Honourable Leader of Opposition.
Yeah, just one small one from you. A big part of workload that obviously entertainment, but there's a significant drop along our entertainment budget. Why not?
Honourable Deputy Prime Minister.
Thank you, Chairman, and thank you, Leader Blongo of Opposition, for that question. So there was an increase in entertainment this year because in the first time we celebrating birthday blocking. Next year they hope that they can reduce the entertainment partly, but the increase was because birthday blocking where what the cost, meeting what the cost here. That's the explanation, Chairman. Thank you.
Thank you, Honourable Leader.
Next year, by celebrating birthday blocking, no?
Thank you. Thank you, Chairman. By celebrating, but by marking, but because that's the first time, so it make him happy go. That's it. Oh yeah. Oh, same Leader. Thank you, Chairman.
Thank you. Okay. With that comment, I'm now going to put the question. The question is that the sum of $11,570,680 for head 08 stand part of the schedule. For those in favor, say aye.
Aye.
Against, say no. I think the ayes have it. The ayes have it. Next head is head 09, Ministry of Health and Medical Services. It is proposed here that the sum of $728,507,879 for head 09 stand part of the schedule. If any member wishes to comment on this head, please refer to pages 168 to 231. And of course, we still have any reference we want to know on the findings of the PAC. The pages available, you can access pages 79 to 86 of the PAC's report. But as I earlier alluded to, for your understanding, that our consideration of this head will go by page, but also as it covers departments on that head. So for head 09, we want to start to comment on that head. Please refer to page 167 is on the summary of the expenditure, but the details are, the first ones are on page 168, 169, and 170. Is to do with the central headquarters and administration of the ministry. Any comments on those 3 pages in regards to the central headquarters and administration? Any comments on those 3 pages? Thank you. Thank you, Honourable MP for East Choiseul.
Thank you, Mr. Chairman. Me, PSC report here now. Anyway, thank you, Mr. Chairman. The 3 services that, of course, getting more resources from the government, and rightfully so. Ministry of Health and Education and Security, which should be the priority of government, and we even want an effective delivery of essential services, and health is very important. I think one matter that is raised is the when we say the growth pattern of the budget law health. What should be the ideal growth pattern of health budget for addressing health services law country? I don't know whether this exercise on the real cost of delivering health services has been carried out. So that that should also happen in the Ministry of Education, Ministry of Threefold Essential Services, Education, Police, and Health. I don't know whether that exercise is carried out, but the point that is raised here is that the pattern of growth and what should be the ideal pattern of growth for health services, for delivery of health services in the country, and whether the services rendered by NGOs, private sectors, and the churches are also factored into that calculations of the growth pattern. Maybe you help me with this one, and so you see you allocated 728,507,000 budget law this year, Mr. Chairman.
Thank you, Honourable Minister. Hal.
Thank you, Chair, and thank you, MP, for his choice of for your generalized question. I'm really difficult to find it on the budgeting code, but just a snapshot about the NGOs. NGOs can be defined as church-based hospitals as well. You would see they are budgeted under different provinces. Like if you go to Malaita, Aitoifi is budgeted under Malaita province, which they call it church grant. And then Guadalcanal, you will see that it's budgeted under the church grant under the Guadalcanal province head. But to give you a financial need for the health, which is essential for the lives of our people, looking into the PAC report, it stated 80% for the recurrent and then 20% for the development budget. The real amount, if I could say, is we need around 1 billion for recurrent and 200,000 for development budget. And you can see that I'm still eyeing for an increase in the coming years if you want me to improve healthcare services in the country. So this budget is increased as of last year, 700, and we increased 28 million this year on the recurrent budget. I thank you, Chair, and I thank you, MP, for his choice.
Thank you, Honourable Minister.
Thank you, Mr. Chairman. So sorry. Thank you for that response. Actually, the PAC Longo inquiry blog, what looked into the growth pattern used to be 41%, and it dropped to 14.5% growth pattern. I'm assuming if the time seriously affecting the delivery of health services in this country, we really need to be concerned about, Mr. Chairman. One general question, Mr. Chairman, before we want to. He understand him. This is to do with payroll. I think Threefold consultants are leaving this country. Threefold consultants are leaving this country or to go for greener grasses somewhere else. And also some of the nurses too are leaving. That doesn't speak well along health services in this country. You want to say exactly what the reason why our section here, our consultants are leaving. That affects the delivery of health services, Mr. Chairman.
Thank you. Honourable Minister.
Thank you, Chair. Just to briefly answer the previous question, there are two factors why it's reduced in the percentage. One is in the PAC report, which one is reduced partnership support, and because of the off system. So there are some donor partners that they assist the Ministry of Health that have off system. If you see our budget, why it's reduced, like for example, NFA, we make it an off payment system, and as well as Gavi that's responsible for the vaccination for our Pikinini. For your general question, Chair, through you to the East Choiseul MP, my good friend. You know, there is a global deficit of health workforce around this globe. And as per the WHO, it's a 10 million deficit of health workforce. So it's created a vacuum that flows towards that stronger economy. It's not only Solomon Islands that we're going to face this health workers migration. It's across the region and across the globe. There's movement of health workforce because of the deficiency of health workforce across the globe. It is very obvious that our medical doctors or practitioners and health workforce, they are very marketable and attractive, not across the region, but there are some as well that wants our nurses to go there. If you look microscopically into the arrangements of how we train our medical doctors, is we have the bond system up to 5 years or so. And after 5 years, they have the freedom to move wherever they want, and also if they complete their contract. So the binding principle is actually on two principles. One is when we train them with the bonding system, and second one is with the contract that we currently have. If I could let this House of my reactive way to control this, there are two ways. We train them and we treat them well. Second one is that we need to go with some discomfort in our amendment of our laws, considering the importance of our health workforce across the country. And another one is what is in my mind on the other side of the House, and my good colleagues on the side of the bench, is to address the tax that the health workforce that are paying in terms of their pay as you earn, and as well as addressing, the contract. Some of the contracts, contractual arrangement with our health workforce, they are paying 40%, which the professional tax as per our laws would be 20%. And those are some of the things that is in my mind to address as part of the retention. Thank you, Chair, and I thank you, MP, for East Choiseul.
Thank you, Honourable Minister. Honourable MP for Small Malaita.
Thank you, Mr. Chairman. Me happy to Maslo, Dr. Law Minister. I think this policy or the intent for retention law work force law you mean law, especially law medical and more especially law nurses. Government come up with a paper making me dream law here. But question law me relate to the law nursing. Also, me hear law talk law Minister of Foreign Affairs time and respond law. I think there was a question related to when I met about the PALM scheme here. He seems to impress on me that him sounding with government him like for promoting me. So that's a policy issue for government. You mean him good for standing probably, but it's a very important policy issue where you mean it for make him good here. If we are going to encourage it only to the detriment of health services delivery in this country, then I think it's a policy where you may need to relook. Thank you, Mr. Chairman.
Thank you, Honourable MP for Small Malaita. Honourable Minister.
Thank you, Chair, and MP for Small Malaita for your wonderful comment. I'm taking note of it. Thank you.
Thank you. Any other comments, Honourable Leader of Opposition?
Yeah, thank you, sir. Just general policy first time, go back law, comment law, MP Blow Small Malaita with regards to labour mobility. I think overall, government needs to have a policy where cap numbers across different sectors. Oh, so many nurses knows I'll go, once I've got some numbers, or doctors or engineers, because this time I'm stuff for open here, or lawyer or engineer go to it. Some will go pick up all first time, then hope for other things. We do need to be way more intentional about this one. Make them no affect our own growth. And then we come to the supply of doctors in particular. Of course, supply of nurses too, but supply of doctors in particular. CNU already has a production line of nurses, offering courses lo but sad lo doctor yana. The size of our population and the growth rate and the level of experienced and qualified doctors below the postgraduate level is high already. That we can have a fully fledged medical faculty at CNU. So perhaps that needs to be, a little bit energy put behind that one. I think there's been some initiatives taken, but for fully fledged one for Bharat, you mean like in 27, you've got a medical faculty up and running, so many students per year, where we target our own needs, but also a small country around here by interest too. Vanuatu, Kiribati, Tuvalu, Kolsem. So there is a ready need, catchment for that. I'm just wondering whether government wants to move in that direction and how quickly. Thank you.
Thank you, Honourable Minister.
Thank you, Chair, and thank you, Leader of Opposition, for the good question. This is what we need in the region. I'm already in discussion with the Vanuatu counterpart. Even in my recent trip to Fiji during the WHO, we also explore who are interested, like for Fiji and PNG, they already have their faculty. I'm also in discussion with my counterpart in Papua New Guinea if we can increase the quota of our intake of our medical students there. So these are some things that are in discussion. I will next year visit medical faculty in Papua New Guinea, because in terms of the practice, the context of practicing medicine is quite similar. So those are some of the in discussion. So I actually flew with the Minister of Health in PNG to Solomon Islands with this discussion, and we are exploring that opportunity. Another one is to have a Department of Medicine within CNU, to which we are having the idea of doing it, but we need to calculate the economy of it on how we would be able to do that. Studying medicine or producing medical doctors are not cheap. It's not cheap here in Solomon Islands and, of course, in the region, but those are opportunities that we are exploring. And I thank you for the questions that is put forward. And I do take note of your suggestion for us, the government, to push the idea quickly. Thank you, Chair, and I thank you, Opposition.
Thank you, Honourable Minister. Honourable MP for East Choiseul.
Thank you, Mr. Chairman. And this is a question relating to the various training subheads and throughout the budget. A point raised by the Public Accounts Committee as well. Probably the first question is where does CITESA come inside here about the budget allocations here? What now managing this one, or the Ministry of Health now? I'm gathering CITESA. You say this one because you have say like page 169 head 224202 10109. You got an allocations of 4,500,000 for in-service training. I'll say this. So we're now managing this one, CITESA or the Ministry of Health. A point raised by the Public Accounts Committee is that I think the point that the Ministry of Education Training needs blame, and we toe the line behind every others. Also, we should actually be prioritizing Ministry of Health, and if we got a budget allocation for it, then of course what the in-service training below Ministry of Health should be prioritized. There should not be any reason why they should queue behind the line. Law CITESA, Mr. Chairman.
Thank you. Honourable Minister,
thank you, Chair.
not here, but you can respond to
yes, thank you, Chair, and also thank you for the question from East Choiseul. With the data that I have now is with CITESA, and the one in the budget is the short-term training. So for qualification training is managed by CITESA. Thank you, Chair.
Thank you. Honourable MP for East Arare.
Thank you, Chair. Thank you, Minister. Just on 169, Mama.
169.
Page 169. I think there's a few items, they're new ones, but the budget is small numbers and venue higher, 1,000 no more, another one freight, 900 no more, what the kind of thing. In terms of how our policy no more, how Imigogo doing budgets, I mean, with this very small kind of budget code, maybe we're talking about the budget code there, venue higher, I am now, 22255 101 09001 1,440, and then the other one is the freight, just further down the page, almost $900 there, and code again is 22602 101 09001. But my question, Chair, is about drawing up of these kinds of budgets, and this kind of budget heads for very small things. And maybe you can put it all, lump it in some fala miscellaneous, or make him, them look at him policy, but them look at him too small for me. Para look at him big budget or something. Is there another policy way where if you look at him where things can be lumped together in another item, where perhaps you mean look at what kind of number or symptoms? Thank you, Chair.
Thank you, Honourable Minister.
Thank you, Chair, and thank you, MP for East Arare. You'll see there are very small amount, petty amounts in the budget. It's because of the chart of accounts time what they're doing posting when they do the budget. And for example, the venue hire 1,440, it's the new allocation for the health information management system meeting, for one-off meeting for next year that is planned for. Thank you. But it should be, improved for miscellaneous that covers a lot of small events in the ministry. But unfortunately, it's the chart of accounts within the Ministry of Finance that code now. So unless we revise those chart of accounts, we can put one big head. That's the miscellaneous chart of accounts that we can plug all this small budget into that. Thank you, Chair.
Thank you, Honourable MP for East Arare.
Thank you, Chair. And thank you, Minister, for that one. Yeah, I think, budget blue over a big one, then you carry more. I'm sure what the accountants, Mr. helping me out. Okay, we move on to the one on electricity. So electricity here, it's just below that freight one, we talk about the policy question is, I see that it's increasing by some 7 million here over last year. Account code, if you like him now, this fellow 22651 101 09001 electricity. We see that there's an increase of 7 million for cost. Electricity is about over 42 million now. Important because we need electricity. But I just wanted to ask in terms of policy, law ministry, and perhaps the wider mines and energy about how now we might work towards perhaps look for reducing this one, or renewable energy kakami little bit here too, or what now policy health side management energy, because this one I'm looking as every new building but come online here by him start for go up more kind of which of course I can't say now. But my question is any plans how if I might look on the side perhaps use renewable energy too, or for health and barahat na for doing more kind part energy. We can't rely on unreliable energy sources, can't say now. But I just wanted to know if there's any plans in terms of how to manage our electricity consumption inside Law Health. Thank you.
Thank you, Honourable Minister.
Thank you, Chair, for that particular accounting code. It's an increase of around 7 million. This is to anticipate for funding now electricity bill for covering our additional health facilities comes 2026. and that is the CMC, Comprehensive Medical Center, Bloimi, which we yet to understand what is the consumption of the electricity load for that facilities. So that's the number one reason, and the other one comes the Naha Bathing Center, which we will be the one responsible to look after the electricity bill and as well as Kilufi. So basically, though that accounting code specifically for the new facilities comes 2026 that we anticipate to open. In terms of our policy thinking on how to reduce cost, you know, health is quite very expensive investment. I will not say expenditure, but in an investment for our country. Been in discussion with WHO to start putting solarization on our ministry, our health headquarters. That's starting, and of course then moves to other new health facilities. So it's already in discussion with WHO to help us with the solarization of that. Secondly, what is in the pipeline? We yet to complete the discussion. I'm already in discussion with the CEO of the Solomon Power to use our rooftop. But then what hinders me, again, what stops me a little bit, is my idea of addressing the business case of NRH to improve the current number 9 Bloyumi, then put them solar on top. Otherwise, we put them solar on top, then destroy more, then we be doing more renovations inside. So those are some of the challenges and the way forward. So there are people that want to help us on solarization of our health facilities, Chair. Thank you, MPs. Arad.
Thank you very much, Chair, and thank you, Minister, for your responses. Much appreciated. Still on energy, I understand that there's direct connections from Solomon Power to our medical facilities. Will this continue on beyond number 9 to, say, the Comprehensive Health Center and the Naha Birthing Center as well, in terms of ensuring that power and continue on to this critical infrastructure? Thank you.
Thank you, Honourable Minister.
Thank you, Chair. Thank you, MP for Istarere. In health system or services, energy is very important. Ensure that you have energy security or energy safety. So, of course, yes, Chair. Thank you.
Thank you. Next page, page 171 on the internal audit.
Yes, sir. Just before you go to 171, medical assessment, I take it that this refers to referrals go for overseas. The actual blow 2024 is only 3 million, and then 25, 7 million, low estimates revised, and again, same amount for 2026. I'm just wanting to understand a little bit more about the referrals from here, NRH go overseas. Yeah, how many? What's the average in terms of cases that are referred now, and outside of, say, members of parliament or constitutional post holders who are covered by entitlements, but for ordinary Solomon Islanders where Ogata fall in this one, how many cases per year on average, and which countries are we making referrals to? Thank you.
Thank you, Honourable Minister.
Thank you, Chair. Thank you, Opposition Leader. I don't have the data at this stage, but I think I would explain the referral system, or how do they refer patients to our overseas health facilities. Number one is when you see a patient, then the consultant will then refer the patient in discussion with the referral committee, which is chaired by the medical superintendent. And once it's approved, then payment by him, Ministry of Health, headquarters. So that's why it's budgeted there 7 million, and then go overseas. So they are basically Australia, Philippines and India. We are looking. Recently, I'm signing a MOU with the MIOT in India, in Chennai, for us to refer our very difficult, complicated patients that need extensive procedures like brain surgery and so forth. Fortunately, in areas of cardiology, for heart, for doing stenting and also, we're doing here now. But we are very uncertain yet now, have never keep him same budget. We don't know the caseloads pertaining next year, so just to be safe, we maintain the same budget, 7 million, just in case we will like reduce him, but stuck a caseload come where CMC Bloimi him knows have a cater for him. So the budget, Chair, through you to my good friend opposite, it's a safety buffer no more. That's the way we maintain the same budget for comes 2026. Once next year we make assessment that most of the cases that for cardiology, for heart, for kidney, nephrology and urology, for bladder, and then we could be certain, okay, we will be able to do this. We can reduce the budget for referral in these 3 specialized areas. But just to be safe for our people, I think it's just ideal to keep the budget same one so that we know that we have some financial buffers when it comes to, caseloads next year. And I apologize that I couldn't give you the exact average, but we are looking into that same budget for safety people. Thank you, Chair.
Thank you, Honourable Minister. Honourable Leader of Opposition.
Yeah, thank you, sir. So, I expect that because CMC by hemi start now, yeah, nephrology, cardiology, and what move on? Urology. So we would expect the reduction in referrals log at tribal areas here. But then, of course, we've got to pay for dialysis consumables and something else too. So that will pick up. So it'd be useful to get a balanced picture of total costs here, everyone, to see that there is a net gain in terms of doing it domestically. Of course, at the moment, who meets the consumables to the CMC? Is that currently being equipped, supplied by PRC, or HEMI come directly under LOMO, Budget Law Ministry? Thank you.
Thank you, Honourable Minister.
Thank you, Chair. Thank you, Opposition Leader. Currently, it's supplied by the PRC, but next year we will put not some, but most of the consumable for CMC. So you'll go to the National Medical Store, the budget, we still like keep him there because of we want to fully operationalize the CMC by next year. Thank you, Chair, and thank you, Officer.
Thank you. Honourable MP for Small Malaita.
Thank you, Mr. Chairman. Budget was $7 million for CMC, where Minister Hemi Talem Kamera, me like Savi Wena, him inside lawyer.
Honourable Minister.
Thank you, Chair. There is no budget plus CMC by looking law NRHs. NRHs got to discuss him. But I'm just saying that you look by me go through the National Medical Store by baseline name still start. But the question comes from the Opposition Leader is about 7 million is for overseas referral patients and not for the CMC. Thank you, Chair.
Thank you, Honourable MP for Small Malaita.
Thank you, Mr. Chairman. Operational cost belong CMC, and Minister just tell him come here and go ahead and the PRC no more to look after and even probably training and also too. But some of the things when Minister you tell him come here would sign away cost low a little bit higher. So also him now me want to say whether you got any budget for him too or no more, because you say about supplies and some follow come under medical store no, but medical store him also him current supplies no more and no anything also in power increase. Thank you, Mr. Chairman.
Thank you, Honourable Minister.
Thank you, Chair. For consumables, Lumia come under budget, medicine and dressing, National Medical Store. So by you looking that we will keep him, the same amount. There are some adjustment within that. When we reach the head below National Medical Store, then I think I could explain that one. How now National Medical Store, Waka. Thank you, Chair.
Thank you. Page 171, any comments on that page, internal audit? The Honourable Leader of Opposition.
Yeah, thank you, sir. Just a comment I made, time you may look long education. Now that we have an increasing health budget, an increasing allocation, there will be need for a little bit more resources allocated to internal audit. So we avoid issues for same law passed, yeah? So there's a more risk planning law where risks stop law so that there's audit inspection, so we know that procurements and payments and all that something law health sector we meet in probity standards and accountability and all something also. So there's only one normal internal audit, one person. Given the 700 million allocation, it would seem disproportionately low. Too much work for one person. Thank you.
Thank you. Honourable Minister.
Thank you, Chair. Sorry, can I ask my good friend to repeat the question?
Because the increase in allocation overall, there will be need for more internal auditors, and so perhaps not so much a question, but perhaps Ministry to explore increasing that small unit here. Thank you.
Thank you, Honourable Minister.
Thank you, Chair. Thank you, Opposition Leader. Yes, we still need more officers for internal audit, and I'm taking note of your suggestion, as the audit is very, very important in our ministry. I have the audited report brief every time because I'm very cautious about our financial management. And if you can see the budget, me also like for training Ogata provincial directors as well on IOB to really know how to do the financial reporting and also. So, Chair, thank you and thank you.
Thank you, Honourable Minister, Honourable Leader.
Yeah, thank you, sir. Minister, for clearing what now? Neglected tropical disease. I'm looking at the establishment now. Unit law here.
MLO page what?
MLO establishment, page 36.
Sorry.
That relate to the internal audit?
Mandalo headquarters, yeah.
Sorry, Chair, because you may not go follow page, so I have to find out my reference under headquarters. Neglected tropical disease law. And one for new divisions or new department we would like creating law within the ministry that looks on leprosy and OSEM. So that's the one that we want to do because there are other countries that already eliminating more the neglected tropical disease. You will also no more. And attending the WHA where there are other countries in the region that already eliminate those diseases. You mean no more, so this is a new allocation for establishing another division to focus on eliminating those diseases like leprosy and also. Thank you, Chair.
Thank you. Any more questions, comments on that page? If not, we'll go straight on to actually the
Malaita.
10 pages. The next 10 pages relate to health, medical facilities in the 9 provinces and the Honiara City Council. So any comments any member wish to make, can make to any of those pages from page 172 to 181. Thank you. Any of those pages you can raise a question on the page. Thank you. Honourable Leader of Opposition.
Yeah, thank you, sir. Just before I go to that, Longo Statistics Division, Law Ministry,
What page, please?
Milongo Establishment page 37. So statistics and Mandalo Central Headquarters, centralized. The level of data that is captured, every indicators or key indicators of this sector. I think it'd be really great if there was, my first question is, how regularly do we publish those? Child, maternal deaths, issues law, anemia, the very, very base data that should inform budgeting and government responses and also how regularly do we update those and publish them? Sitting on the PAC, I didn't get a sort of a sense of where we are in these key indicators and therefore adequacy of allocations to address them, to respond to those needs. Thank you.
Thank you. Honourable Minister.
Thank you, Chair. Thank you, Opposition Leader. It's on a quarterly basis that they reported the health indicators. Thank you.
Thank you. Honourable Leader.
Yeah, thank you. Just to follow up. So how is that captured? Is that from every clinic and health aid post, believe me, feed income and the reliability of that data, and how do we access it? Is it made accessible? Can it be made accessible to us? Thank you.
Thank you, Honourable Minister.
Thank you, Chair. Thank you, Opposition Leader. It's captured through what we call HIS, Health Information System, then given to our information team within the Ministry to publish this report. Thank you, Chair.
Thank you. Again, any comments on those pages I mentioned earlier, pages 172 to 181? Any comment on any of those pages for they deal with the same issues? Honourable Leader of Opposition.
Thank you, sir. I suppose it runs across all the provincial health authorities. We'll look at the pages here. But we have struggled with issues also, Gizo, Auki, especially the two larger ones, but perhaps others, where establishment, there would be positions for anesthetist, for example, and surgeon and also, but for various reasons, the doctors that are allocated cannot go down or get stuck either picnic school or Noini House, law province, or what kind of issues also. So I just want an update, perhaps the bigger ones, Gizo, Auki, Kirkira, but also perhaps Lata, because I'm out for good, and Taro. Where are we in getting doctors to where they are posted, overcoming the issues that hold them in Honiara? Thank you.
Thank you, Honourable Minister.
Thank you, Chair, for this very important question, and it's a challenge for the Ministry of Health and Medical Services in our posting because of various factors. Number one is we are developing health workforce strategy. In my debate of the budget, I did highlight that it's ready to be published. We are looking into re-strategizing on how we do posting. Number one, Chair, we would like for Putum work together with the Ministry of Public Service instead of creating a post that for say post within the Ministry of Health. We need an anesthesiologist. You make him go province, then advertise him, and then the contracts will be developed around that area of work. Even in our NRHs now, it's almost 1,000 plus now sit down there, health workforce. So they are having some personal issues. That's why they don't want to go out in the province. As you rightly mentioned, through your speaker to the good opposition leader, that because of education and also with Mangaran family, don't like go out of the province. But that's what it's in the our health workforce strategy. Once we're done with it, and then we will work together with the public service on how to deal with the posting of our health workers, because we don't have a strategy based on posting doctors, and sometimes the head of departments say me like him, or like him that one, a lot of personal preferences for him, and sometimes say, oh, me need for stay lo honera kosablo bank because partner him school, I need to send money. So those are some of the issues that we continue to experience, Chair. But with that health workforce strategy, we would be able to manage our posting. So time me say one fella registrar post lo gizo, hem go straight lo deana, once hem interview go lo deana, rather than they come in one big pool and then the posting committee post them to the provinces. So time and applies have a finish what can post and where now hem go lo hem. So those are some of the improvements we want to do comes 2026, Chair, through you to my good friend, the opposition leader. Thank you.
Thank you, Honourable Minister. Honourable Leader.
Yeah, thank you. Just so if you go to the establishment, by looking at vacancies here, what key areas of care where you may need him, and I'm assuming, so that's for Malaita province, I'm assuming by me repeated Molo, Western province, the two big ones. Golokana province, of course, it's in the awkward situation where I'm not got him a referral hospital, Good Samaritan, Act, also one fellow. Western province seems to be doing a whole lot better. One fellow vacancy there. I'm just wondering whether, is it also an issue, I suppose, going back to the original responsible minister to Member Blois' choice, or is it an issue of incentives also? Do we incentivize going outside of Honiara, being posted outside of Honiara, so that I may mitigate the lure of Honiara, but also perhaps help to meet any additional costs where Oketa might give him up by being away from Honiara? Thank you.
Thank you, Honourable Minister.
Thank you, Chair. Thank you, Chair. Thank you, Opposition Leader. If you see, like from Malaita province, establishment increase for some 52 in total because of 60 new positions. Any gaps lo there, Chair, Bamfala lo HQ na by payroll budget plan by cover. Second question to the opposition through you, Chair, is the incentives for Tamango Wakala province. They do have provincial posting allowances. But as I said in one of your questions, we answer now how many allowances now, what they can. So those are some of the things that we do. But we still have a health workforce migration because of the vacuum, as I said, deficit of 10 million globally. So just on this thing, Speaker, if me like for highlighting here for people blowing Misawe, look at the provincial budget, if you look at me, him increase, everyone increase. Malaita next year by 40 million for Raisnol. Me looking Makira, 17 to 18 million. Western from 17 to 18 million. Isabel to increase from 12 to 13 million. Central also increase as well. But only one that is decreased, but we will cover those establishments. Guadalcanal increased to 23 million, as you said. Guadalcanal next year, but you look at DB, we are allocating 500,000 for start for the preliminary work, law hospital, Lord, and I really thank you for bringing up into one of the questions in this parliament for this year. So basically, law province's health services, we will increase him now, Okata budget. But not only that, they are also supported with them now, budget support. The total of 53 million. So I am sure that there will be some slowly increase of how we do things with our budget increase comes 2026, Chair. Thank you.
Thank you, Honourable Minister. Honourable Leader.
Yeah, thank you. Again, on provincial health authorities, any update long Taro work where we go long or the fiscal infrastructure long Taro? Thank you.
Thank you, Honourable Minister.
Thank you, Chair. Thank you, Opposition Leader, on the Taro work. Throughout this year, we are trying to get Taro to start the renovation. We are eyeing for PRC to support us in that, but somehow the scope of assisting us in the Taro somehow have not come to fruition. So me budget team now this year LODB, Law Development Budget, so Taro have means Law Development Budget for renovation. What the PRC wants is the total new hospital. So if that's one, then we put them on mainland, and then what appears in the development budget for 2026 is for the renovation of the existing Taro hospital. Thank you, Chair. Thank you, Opposition Leader.
Thank you.
Yeah, just a follow up. Thank you, sir. So all this while meeting say you may side Taro, some work has gone into making sure, because that's all building white and sky came go me almost collapsed no one. I'm very unsafe. So I assumed obviously wrongly that some work had gone into putting a new one side Lohem already, but we're talking about renovation no more. So nothing's happened in the last 2 years. Thank you.
Thank you, Honourable Minister.
Thank you, Chair. Thank you, Opposition Leader. It's only the scoping work that we did, preliminary work now for Taro, for the new facility plus the renovation. Thank you, Chair.
Thank you, Honourable MP for Small Malaita.
Thank you, Mr. Chairman. Me no know what page lo you but me lo page 181. Me go back or me go forward?
I already told you from page 172 to page 181.
Okay,
Any comments
thank
on
you.
those pages?
So, question for me, related to Naha Birthing Center. Me one is me understanding from I think one of a response from Minister on governance side there, by him come under City Council also. But staffing lo hem not be lulu establishment. I think something was imposed up over 35 positions where him vacant. Yeah, me want to have two question. Yeah, one is if him vacant because him inside the establishment for 2026. Me like sabe where now budget for him. Him stop lo headquarter or him long City Council. Thank you.
Thank you, Honourable Minister.
Thank you, Chair. Hemstaplo headquarter. If you see the summary, Hemstaplo headquarter now budget for the 35 new position for Nahabeti. Thank you, Chair.
Thank you. Honourable Leader.
Yeah, thank you. Again, Lo Malaita Province, Kilufi in particular, and in particular this for mental unit here. Is for wood mental in that facility is really run down and is no longer fit for purpose. A few months ago, septic here were full up to overflowing too. Not very sanitary conditions, but certainly there's need for more beds. Not because more people are becoming mentally affected, but I think as a proportion of the population is probably keeping the same percentages no more, but the population when those facilities were established, population of the country 300,000 no more. We're now 800,000 something. So there is need to do something about those facilities and the services that are being provided. So you will think how low this one. Thank you.
Thank you, Honourable Minister.
Thank you, Chair. Thank you, Opposition Leader, for the mental health. Mental health never come under that one. It is indeed important. It's one of the definitions of health. WHO said triple things. No more. If you got a completeness, then it's you have a complete health. That is physical, mental, and social well-being. Mental health, and but our last one to look bricks here, Chair. If you look him. We are looking into the acute care NRIs. The design is completed with the head of department, Bloyumi, on looking into the design for acute care. For the case of Kilufi, thank you, Chair, through you to the opposition leader. I will ask my infrastructure team to go down there. We are planning to go and visit Kilufi because of the new infrastructure, but because of the parliament. After parliament, we will go and visit Kilufi again because of the major project. I will, maybe you can come with us to opposition leader for us to go and visit Kilufi. For the deterioration of the facility, thank you for informing us in this house. I will ask my infrastructure division to do a scoping and an assessment for that one. Thank you, Chair.
Thank you. So to those pages, the Honourable MP for East Harare.
Thank you, Chair. Thank you, Minister. I think earlier on the question was asked about incentives for allowances or people go out, stay a lot time more remote, perhaps hardship places. I see that there's a few allowances here, special duty, and throughout the pages across the board. Maybe the Minister can break them down a little bit, various allowances, and then there's special duty allowance. What now involved inside law these allowances in terms of sample hardship or anything to talk about now this one, or encouraging doctors or nurses for go and work or the rural places blame me. Thank you.
Thank you, Honourable Minister.
Thank you, Chair. If you look through the provincial budget, the 9 provinces, I think they have those allowances which mentioned by the MP for East Harare. Those housing allowances, cater now for under the establishment of public service rental scheme, and then various allowances for public servants, especially also attached now public service scheme of service. For the special duty allowance, what the allowance is here now, we usually attach with them what the cooperative service workman within the ministry. Thank you, Chair. Thank you, Mr. MP.
Thank you, Minister. Honourable Leader of Opposition.
Yeah, thank you, sir. Longo Western Province. Me like for Savin Helena Goldie after the handover last time, new building facilities here. Or get the move go in now, and are they now using it, or they're still in the old facilities? And then secondly, the School of Nursing, Law Helena Goldie, whether they are, or when can they, I think that we asked this question last year with regards to 2025 budget, and some assurances were made about resuming classes, Law School of Nursing, Law Helena Goldie. So some update on that. Thank you.
Thank you, Honourable Minister.
Thank you, Chair, for the first question. Yes, there are some of the services already provided now after launching. Second one, about the School of Nursing. School of Nursing within the budget. We also budget for both, because hospital bloodsheds, Bloimilo United. We do budget support for the faith-based hospital, not only for Helena, but also Good Samaritan and Aitoifi as well. By looking Golo there, we have given those health service grant locata. For the School of Nursing, it's also supported there. What I was informed that it will be also supported through our service partnership at MD5. Thank you, Chair.
Thank you. Honorable Leader of Opposition.
Yeah, thank you. But are there students there now? Are they teaching? School not start now or no, mate?
Thank you, Chair. Apology, I don't have any information about whether they started now or not yet. I will inform the House once I get reliable information on the School of Nursing for Helena. Thank you, Chair.
Thank you, Honorable Minister. Any more comments on those pages? Page 172 to 181. Thank you, Honorable MP for East Harare.
Thank you, Chair. Thank you, Minister. Just coming back to the allowances and perhaps how for rewarding our workers and doctors and nurses who are perhaps facing some hardship going out to some of our remote, isolated places. Whether government in terms of policy are looking to reward things like accelerated incremental payments. I think every year now, annually, I think there's increments that are done that way, but I know there are certain attraction when you go to those places, you qualify for some accelerated for your increments. Don't have to wait for a year. Sometimes 10 months or 8 months, you accelerated now, kind of sense. So in a way, it probably gives some incentives for those people who are going out there to do that kind of work. There are some other allowances I know that they call mobility. The more you move around to those other places, the more you move faster. And sometimes they're even linked to promotions. The more you go out to those places, the more you will be looked at for promotions. These are other things that perhaps doesn't mean chilling, but in the long term or in the medium term, it might help attract people to move out, looking at their own career path, moving forward in terms of pathways. But is there any thinking behind these kinds of incentives that are not necessarily remuneration immediately, but something that might add on to career pathways moving forward? Thank you.
Thank you, Honorable Minister.
Thank you, Chair. Thank you, MP, for East Harare. I really like the suggestions that you have put forward. Just to inform the House that we are, like when I came in and get the portfolio, I'm in my first year, I do fix, and even I'm quite tough. Yeah? I'm fixing the medical supplies until to this date, ensuring that there's a critical item available. Now, I have 5 pillars, as I always said in my speeches, that I am looking into. If we want a good healthcare system, we have to have a good, improved health infrastructure, good health workforce, then health workforce that comes from your suggestion, which is the human resource. I really asked my team to develop a robust human resource health system. I asked them that I want a system that continues to do what you have just suggested. So thank you for that. Also, me just like for informing opposition that no student yet, Helena Goldie. I was just informed, so I think it's good to inform you as well. No more yet, no start. Thank you. Thank you, Chair.
Thank you, Honorable Minister. Honorable Leader of Opposition.
Yeah, so what time by I would start? Helena Goldie, School of Nursing. And me ask every year, this one is, so we must tell officials, hey, man, ask me what time. But what goes up, say, what time? Kind of thing. You know, the dilemma. They used to provide a really good program of nursing, and of course it's faith-based. So Helena Goldie School of Nursing and Atwaithi School of Nursing are both very important institutions. We must support them all to good. Just in terms of G Province and Good Samaritan, and of course the need for Guadalcanal to have its own hospital. So, you know, one option obviously is to build a completely new hospital under the Provincial Health Authority, but the other is to acquire more land around Good Samaritan, work with the company and landowners, and expand them. And there is no there shouldn't be any impediment. Good Samaritan has worked well. The minister himself, hemi para blossom and flourish lo there, time hemi in charge lo there. So a partnership between the government and the church, the sisters well taranem by me, I think would be a very fruitful partnership. But it does require, Kodaknal is a big province, and that's the largest segment of the population now, and catchment below Good Samaritan. And matters of staff, housing, 500,000 is not going to be enough to address the constraints, bottleneck, staffing. Emi relate go back directly normal number of houses that are available. And perhaps if something like that could be done, then companies around, Goldridge is very keen to participate. They said they would be happy to fund some of that expansion, and I'm sure GPOL would be also. But we need a timeline on these things, working, of course, with leadership law G province, but not allowing it to drag. Consultation have the drag, it's such a big population that you may not allow for him to drag too long, is my concern. Thank you, sir.
Thank you, Honourable Leader, Honourable Minister.
Thank you, Chair, and I want to thank my good friend, and thank you for visiting Good Samaritan in this year. Thank you so much for seeing some of the realities. That's my grown-up home. Was working there, and I do know the challenges that deals with Good Samaritan. Good Samaritan, it's some maybe technical issues related to the land. I was a medical doctor, and I worked there as a community person. I usually want to always assist Good Samaritan because it's very important for our people across Solomon Islands that they went to work at GPOL and work at Goldridge, work at Tina Hydro. And of course, Chair, if I could say that someone lo town to come for Tekem Healthcare Service, Law Good Samaritan. The whole population of Henderson, Corona and all this, that is a hospital that serves them. For the data, if you do comparative analysis of data or the case loads of the hospital, Good Samaritan Barahai food, when I came, it's about 30, 40 now, it's going up to 150 a day for the patient. And it's really because of the, people come and work. But if compared to other provincial hospital, some are 20 per day or 30 per day, but Good Samaritan is loading a lot of burden. And for that, Mr. Chair, let me essentially acknowledge, if you look, compare them, Aitoifi and Good Samaritan, Aitoifi get more money than Good Samaritan. So if you can see, it's a quite sad thing, and I think opposition leader, you note him in the low budget. It's only 1.8 million per year. That's what Good Samaritan get, an increase from 1.4 million. But it's an economic hospital that saves a lot of people, that produces, that pays pay as you earned. All the companies there that they pay a lot of tax to this country. So indeed it is not only as a minister's vision to expand Good Samaritan, but as a member of parliament in that constituency. And I have even Sape Farm also supported them as well, Mr. Chair, GPOL, and I have talked with Goldridge of their intention, but I'm saying to them that let's build another one so that we can expand the service. So maybe put to one follow Foxwood or same, because there's a lot of people moving in there now. Corona area and up to where the liver land is. So it is ideal that I must say that we need definitely a hospital around Foxwood so that it saves the population there and our people. They are part of us, Mr. Chair, and I do thank the heart of the opposition to always pester me inside of this chamber for talk about Good Samaritan. I think second time or third time now. And so as I always talk about Kilufi Hospital. So imtala exchange. No, we talk about hospital or constituency. We talk about the hospital or constituency. Mr. Chair. So when we deal with the land, Chair, we will expand. We will expand the hospital. There are some land issues. One group holds the FTE and one group holds the PE. I've been sitting with them, trying to harmonize the solution there as a member of parliament for that area. So bear with me, my good friend, opposition leader. Once we settle the land, we expand. Thank you, Chair.
Thank you, Chairman. You know, I was recently in Reynolds, and time for member blow South New Georgia, and me story with him nurse there, and he made quite an interesting observation. I asked him what now are the common illnesses, diseases that people present with him. I say, oh, I'm around Lo Lake here, Lo clinic Lo SDA village Lo there, and the nurse he said, oh, generally, say pneumonia because of got diphtheria. So to present with him respiratory illnesses. Say, but once ship him arrive, me by notice him about present with other diseases come from noodle and processed food and all same. So this one too, I think, with regards to Gualcana, because people have access to honiara and noodle and no processed food there, we are going to have to put up with or expect illnesses that derive from highly processed foods, and therefore the need for the expansion of secondary medical services. I would advise against moving it to Poxwood. Nara Good Samaritan Paris na rotuan. O sa Good Samaritan no mo ba?
Manana forgive.
Yeah.
Good Shepherd.
But a little bit more accessible to number 9 and Honiara Town Council facilities. The further out it is, the better it is for more people to access it who are further out from Honiara. So it's just the spread of resources might be an issue. Ogat man whereas go Wawakem house lo Poxudi, ay ot man garam tarakin. What's a racist camera number 9 weba? But ogat man further out here now. Important. One of the things I was really impressed with, which was established, of course, by the minister when he was there, Good Samaritan, was the community outreach program from Good Samaritan. Again, the detail is not here to give an indication of how robust it is, but the workload of that community outreach service is disproportionately large to the resource allocation Lohem. Overall, when I look at all these pages for provincial health authorities, there is a good emphasis on primary allocations to primary health. This one bar of good, but within that, I want to encourage the government and provincial health authorities. This for community outreach here. Bar of go inside village now and go take them health to people. Blooming make them no come, but also a lot of issues we address at that point. Thank you.
Thank you, Honourable Minister.
Thank you, Chair. Thank you, Opposition Leader. Noted with your recommendations and suggestions. Sad look folks should know more. Even at Lohoniarana, accessing Good Samaritan, there are a few at Bench Creek and eastern part of Honiara. Me story with them too. Favorite. Hem good number chair for talem tabu inside the parliament. Yeah. For a little story finish about him land, but we will wait a bit. Good safer. So thank you, Chair, and thank you, Opposition Leader, for your recommendations.
Thank you, Honourable Chair of PAC.
Chairman, this will come back more na bathing clinic here. Me like naming Good Samaritan bathing clinic here, but you will no by Good Shepherd no, I'm not saying, but Estonia I'm no agree lum Estonia I'm behind lum. Sure, I just want to come back to the manpower vacancy for
2026. I've noticed that there's a huge vacancy law there, but I think Small Malaita, I'm asking question here, and you were responding to Small Malaita by saying that it is somewhere in the central headquarters, yeah? But
Go back one.
no, because I'm still the Central Honiara. Sorry, not Central Honiara, Honiara City Council. So I just want to be sure no more that those vacancies next year will have no problem, to be provisioned. Miluklo headquarter blue and same no moment. Same. So which part of headquarter will that be provided for?
Thank you, Honourable Minister.
Thank you, Chair. One for big increase now. Thank you, Member of Law Parliament for Central Honiara for the question. 17 Law Honiara City Council, Law establishment, 73 new position by out of vacant, 45 midwives, and of course, now for Naha betting, 45 midwives now within the 73 new position that will be created in 2026. And what are allocations below him now, that part it's a 7.3 reduction, low there, you may look him a slightly reduction if we look at the numbers, but auto reduction covered by the headquarter where summary low him. If you see the summary of the ministry, law establishment, law payroll and salaries here, him increase. Basically for Kavam now, 140 staff, law CMC and 45 now for Naha betting, mainly the midwives. Thank you, Chair.
Thank you.
So,
Honourable MP for Central Honiara.
So say, I think it's important to understand this because, it is all lumped up together in the overall establishment. So this establishment is only numbers normal, numbers below the employment normal law. The provisioning law, resource and law, bricks here. So when you say that it is somewhere in the headquarters provision, but when you look at the headquarter provision, it remains the same number. So possibly next year you will have to come up with a supplementary to be able to cater for that. But it's good that you have a space given by the public service to have the vacancy. So I would encourage you to ensure that next year there has to be a supplementary provision for those vacancies for those very, very important health infrastructure that we will have. One thing that we have captured, say, the way that we look into the chart of accounts in the budget, terms like various allowances here. Various allowances. If you look at the various allowances, it seems to match the salaries. I'm just wondering what now captured in these various allowances, Mr. Chairman, because it seems to be a very, very huge allocation, almost matching the gross salary provision as well too. So maybe Minister, you tell him come, because you are the only one that has that various allowances, where seems to be consistent in terms of the quantum that has been provisioned, almost the same as the salaries no more. Just inform the committee no more, what are the makeup of these various allowances here? Thank you, sir.
Thank you, Honourable Chair EAC. Honourable Minister.
Thank you, Chair. I think this one we also answer Golo member of law is Ariare, but let me again acknowledge the MP for Central Honiara for the observation that you look at the bricks or the chart of accounts and the various allowances or the allowances attached to the scheme of service under the Ministry of Public Service. So within the various allowances law, HEMNA comes with a provincial posting allowance and also with allowances that attach to the health workforce, touring allowance and also MNM attached, but it's very attached to the scheme of service under the Ministry of Public Service now, or the various allowances. And I really thank the two colleague MPs for raising that quantum, because it appears throughout Nalo BRICS here. Thank you, Chair, and I thank Chairman Blow PAC and the member of Central Honiara.
Thank you. With your indulgence, I would like to, first of all, because we are referring to those pages in relation to issues that were before the Central Honiara came in. He was not part of the internal introduction, so I was making reference to consideration of those particular pages relating to those issues are brought up, and I think we don't want to continue repeating the same concerns that have been raised earlier. And for us to move forward, I am proposing that we go straight on to pages 182 to 191, and these are issues that are not going out of the, but I think the issues of recurrent staffing will also be reflected in this general head. So those pages I'm referring to refers to the National Communicable Disease, page 182, National Reproductive and Child Health, 183 to 184, Nursing Council Board, 185 pages, National HIV STI, page 186, the National TB and Leprosy Division, page 187, the National Vector-Borne Diseases, 188, Public Health, Emergency and Surveillance, page 189, and then of course the last one is 10, National Medical Stores, page 190 to 191. If we go by those, okay, it will dispense of this head quickly. And there are other important ones. For example, after these ones that I've read out, it will be National Referral Hospital reference. The issue of staffing will always come up regardless of which divisions, right? And the Minister, as I think we already made reference to, in conjunction, collaboration with the Ministry of Public Service, staffing conditions of service come under the public service entitlements and so on. So yeah, you can't bring it in, but the numbers are dictated by the requirements of the Ministry of Health. I'm just saying this so that we don't bog down with them same questions. Some of those are applicable right across the board. But the issues concerning the committee is to do with the allocation for those divisions, yeah, under those pages, because that's what we are going to vote on ultimately. My apologies if I'm confusing the whole thing, but where it's going, perhaps we should not repeat the same process again, because they're going to come back and again, especially with staffing matters. Thank you, Honourable MP for Central Honiara.
Chairman, I think I understand what you are trying to drive at, but it is a policy issue that I think need to be asked specifically to whatever that has been allocated to a common chart of accounts labels.
Okay.
So when you refer to various allowances, for instance, I agree with you. It applies right across the normal one department or something. So it's a policy issue. When we ask that question, it relates to the policy that is made by public service, for instance, on the terms and conditions of what not various allowances here, emotion. So when you ask that question, then if the explanation is made by the minister, I'm clear now, emotion. So when he says it's storing allowance and other terms and conditions is agreed to by public service, that's fine. But I think we need to go into detail. Touring allowance cannot be that expensive to one student. There would be a policy issue, but could be the public service knows what are the details of those policy decisions on the
Thank you, Chair. Thank you. But
yeah.
what I'm bringing those up because there are specific expenses that relate specifically only to those subjects under those pages. And while the public service policy on staffing is right across the board, include those, but there are issues that you can bring out on those pages because of other costs that has nothing to do with staffing, but are captured separately under those different departments that the ministry is responsible. So it's not only to do with the staffing policy and so on. The committee should also be enlightened with what are concerned, what are the issues, cost concerns as it relates to the different departments, especially equipment and so on and so forth, or what other activities. So yeah, you bring up the cost of service, that's okay, but we'll also want to ensure that the committee also hears what from the ministry, the exact, or as it relates to, for example, the Nursing Council Board and through, does it involve the staffing? Maybe. The National HIV STI, what does it involve? So what we are trying to do is capture all those discussions one time, across those pages. Thank you, Honourable Minister of Finance. You would like to make
Chairman, I think, am I right? No, I mean, what you are raising, but the fundamental thing about the budget is that, we want to make sure that budget, the question that everybody is asking every now and then, what is the true cost of running government services? So when questions like this are asked, it points to the policy issue of, have we done a good job in cleaning up the budget? So that's why we are asking this. But what's the angle that you are trying to drive here? That when issues are discussed and done with, you may stop normal there and then you may ask a new question. I'm not too sure what now.
There are other cost issues, but bears on this that also has to be brought up for the information of the committee. Not only the staffing policy matters and so on. So that was what I'm hearing is just staffing policy and so on. But other issues that covers this, the various departments, they don't have the same matters or subjects or concerns around there. From the Ministry of Health will tell you what is the cost of running that department, right, of this one, including, of course, the staffing issues or policies. Thank you, Honourable Central Honiari, may continue.
Me disturb now, so you may move go malo anyone may buy ask him question. I think you may move on. I think you are absolutely correct for us to move on. Yeah, thank you.
Thank you. Yeah, Honourable MP for East Choiso.
Thank you. Thank you very much, sir. We go to phase 182 now. And non-communicable disease, Kasimi Haram statistics that 7 out of 10 deaths for this country are attributed to non-communicable diseases, and Muslims. So I guess this unit here is, I think the way to read the fight, maybe the minister need to clear him, the way to read the fight against non-communicable diseases is to read it throughout the budget, the health budget also, because this particular unit is probably coordinating no more something also. This national non-communicable diseases, MGRM staff, maybe that's our understanding, the way to read the fight against non-communicable diseases, because 7 out of 10 every death in this country is attributed to non-communicable diseases. So that allocation services is one of a fight against non-communicable disease. The name makes sense. But I think to read I think read it together with him all the other allocations of other budgets. So that's how we understand this. But more specific question, Mr. Chairman, is to do with the policy that you and me established I think time with all of them, and that is the Cuban doctors, Mr. The chairman, the chair of the Public Accounts Committee, I'm raising that one, law report, Logata, and as a national strategy to address non-communicable disease, because the Cuba is the best, MGRM best public health system in the world, Mr. Chair. So, and that's why you go and establish in that one during our time. I'm saying we send doctors for there. And what is raised in the report here is that, the idea is to, what Dr. Seva kami ko posting mo karo logata, o the rural, almost up here, o to go base over the rural hospitals throughout the country. That was the intention at that time when we engaged with the Cuban sending students leaving go for train to Cuba. What is picked up by the report here, Mr. Chairman, is that I think one of the key challenges that we're facing is that the medical institutions, one of them here, they're not accredited by regional universities. That's a shame, Mr. Chairman. Saksini go train kam no for katim legi. They're not for curative. They're not curative doctors. They're trained to prevent people so that you know go katim legi. That's the emphasis of the training local doctors law Cuba. So what go post local the rural clinics and hospitals and teaching people. How come this one? Or no come cut leg. And in fact, in Cuba, they don't cut legs, because they cure it. So, I don't know what. So it's immediately like that no more, or can this be addressed by way of some kind of amending laws, please, so that you recognizing what people have done, what the graduate come to Cuba, they are doctors in their own right. But emphasis, Logata is preventative, not curative. Mr. Chairman, as a broader national strategy to address non-communicable disease. Thank you, Mr. Chairman.
Thank you. Honourable Minister.
Thank you, Chair, and I thank the MP for his choice of for your important question in terms of our human resource in our health space. Indeed, as per the PAC report captured there, we are on halfway to meet the required, as per the WHO, 22 per 10,000, that's the requirement. We are now on the 44 per 10,000 population. Looking into your suggestion on the Cuba graduates, just to let this House know, I came home in 2004, to which the first batch of Cuban graduate came. We are all treated the same. We do the examination to have the board license. So we have a law called Medical and Dental Board, and in every country they have their own board. You need to pass this board in order for you to practice medicine. So there are other countries that are very difficult to obtain a license. A medical profession is a very professional job that you need a license in terms of they assessing you on two areas. One is the medical science, which you do an exam for that, and then clinical science, which you then do for that as well. So Tamifalakam, we all treated the same. We all do the exam, we all trained, and they are all good doctors now. They are all competent. They are saving our people across Solomon Islands. And I'm one of them that we sat the same exam. What I write Logi Paul say, you are recruiting a medical doctor that Hemino got him license for practice lo solo. So I do come and sat the exam. And fortunately, I got a short time for familiarization attachment, and then I go back and work at GPOL. So to train a medical doctor, you not only for you to graduate in medical institutions, but also to pass certain license, what they call OSCE exams, and all these exams in medical sciences, you must pass them to be able to, because it's about life. So you need to be competent to practice medicine. Coming on the doctors' Cuban curriculum, of course, yes, there are literatures that captures the primary health care for Cuba that is really, really good. We can also explore that as an opportunity to post them indirectly into the rural areas, but then we have to amend the Medical and Dental Board Act to be able to capture those so that IMI recognize Imogata in our own law. Unfortunately, as the PAC capture them, they are not able to have go and further their studies in some of the universities. But there are some that can other breakthrough. Yeah? One is doing diploma in dermatology in FNU now, and from Cuba graduate. So though it's difficult, it's not impossible. I think that's my answer to the Cuban graduates. Indeed, primary health care, Cuba has been captured in the literature that they are doing fine. We need to learn from them. And if we are to revisit the same policy as you created in the years back, it's no harm doing it again. We need to see the economy, see the establishment, see how we are able to pay for them. And all these factors need to be considered. And then, as I said, I still need money to increase the services that our people need in terms of our health workforce, establishment, health infrastructure, health governance. All these things are fragmented. And let me, Chair, acknowledge the PAC Chair for capturing now some of the fragmentations inside the budget. I do noted them. But I really thank him for raising those, and I'm taking note of them, and I'm trying to clean him up more recurrent next year, Chair. With that, let's all wish and let's work together to improve our health workforce across the country for the betterment of the healthcare service delivery. Healthcare no blomi no more, employee everyone sit down here. It's good that we talk about it and we discuss it, and together. You meet together, find a solution way forward. Thank you, Chair.
Thank you, Honourable MP for Small Malaita.
Thank you, Mr. Chairman. So, on this matter of training belong you meal or the medical people blaming call Cuba, meeting it's such a critical policy where you must ensure that even how you may doing also delivering medical services, health services in this country, you must redesign them. Because you take them come with doctor where other people were trained for public health, and then you put them over through exams for clinic here. I mean also. I mean, also any other term. We also have karage. So, I think this one have an important policy issue. You me and call blong minister for you me wakalo him important. It's now very imperative. Take him come this one quick time. You need for change him or the exam here. Need for changing our hospitals and clinics. You must concentrate on a little bit more, not only money, Mr. Chairman, infrastructure, we must change him here. Investment infrastructure. We focus on preventative approach here. So every budget what a clinic we make him, hospital we make him here. You look at also one of the man graduate come to Cuba or some place, you think, hey man for operate now. No, yeah. So I think important policy we need for look here, Mr. Chairman. You take him come paper no more minister, make him this one. It's overdue because you may not do NCDs here. Hemi too much like me now. What to train for can prevent him cut a leg, cut finger, cut toe, and can cut him. Aye. Chairman, you saw one in me, or what man, no more. But me got a small question more. I think also responsible or minister or is choice only enough for me now. But me like for re-emphasizing, you must take him come now paper for you may walk alone. But question below me still not training because Minister of Foreign Affairs lo tok blame same like him you me go ahead for send them more people go lo Cuba ya. But you know some mino here me talk some him.
No, me talk also.
Okay. So anyway, that one we must keep him. But me want to travel or other places where we send them people home for training. Sometime in the past we sent I think 100 people go along or where Philippines. What the Philippines? We send them what man like for treatment, yeah. But doctor now we mean send them last time, but I think there was some study telling hey, you know send them now people are there. Me like him minister you sabe tell him where are we on this? Anyone you meet train him lo there stop yet and what's the policy decision long of this scheme here? Thank you, Mr. Chairman.
Thank you, Honourable Minister.
Thank you, Chair. Thank you for MP for Small Malaita. Just a correction law of a Cuban graduate me or no public or no trend public health here. In the course of medicine studies, they do some public health courses, but they also graduate as medical doctors. So like certificate law, they can doctor of medicine law degree block at Now the only thing that other missing is the clinical training. So when they come here, they do the clinical training. So public health is a discipline of its within medicine or the field of medicine, just for clearing that one. And of course, thank you. And me to talk also Minister of Foreign Affairs, we are small MP, small Malay. I really want more health workforce as it's captured. And I thank you, the chairman of the PAC, more medical doctors and more health workforce. Because if I build many health infrastructure across this country, we'll never work inside. So we need to forward thinking about training more health workforce. So just for me, but me to me for more health workforce law, the bilateral talk. Yeah, so that is for that. In terms of the Philippines, I don't have the record, to be honest with you. Good MP of Small Malaita. I haven't have the record of those students that are attending Philippines universities at the moment, or even able to see their performance if they actually work law health facilities. I only know the Cuban graduate, but if you allow me to find a space, I could inform the House in another time. Thank you, Chair, and I thank you, MP plus Small Malaita.
Thank you. Honourable Leader of Opposition.
Thank you, sir. We speak as if Cuban graduates are not good enough. The fact is they're just as good enough as graduates from FNU, Fiji School of Medicine, and New Guinea. So you may not talk as if for what Cuban doctors is somehow inferior to doctors who got trained come law, other institutions. This has been cleared already previously to the House and to various committees for health last time during an inquiry into this matter. It was decisively determined there is no graduates come here, training blood have no inferior in any way whatsoever. But of course the health system law Cuba, OSEM is choice of Palem, is very, very good in terms of both public health and primary preventative health. So I think long term, that's something you must look lohem. But again, I come back to my earlier point this morning. Sinu, train lo here. Train lo here. Let's train 100 here. 200 plus. All kata regional friends believe me come. And bring some professors from Cuba. Many years ago, I'm too long now. I'm Minister of Education. Mr. Story with him, some professor of Cuba too, yeah, the university where students believe me go, and they're very willing to come and teach. Law areas where all katabara of good lohem, where you may need him, and of course then we get teachers, professors from other places too. But meeting him, the need is urgent, is desperate, is right. Resources you may garin for doing, and some of you may here time you may die. Donating body for what picnic kat lohem. We have the clinical base in terms of the population to be able to have our own school here, so we produce what we need for our health system. By FNU, Fiji School of Medicine, will never give us the numbers we need. Just the same as New Guinea. Was not New Guinea. UPNG, my karage, there anything from 10 million to 17 million, who knows what the population is there. The need for doctors in their own health system is way, way desperate and urgent than ours. And this time, what give me for student no more yet. It's very unlikely. Pocket baru blue me, but unlikely for increase because need blockade is worse than blue me more. The time has come. In fact, it came many years ago, but has come now. You set him up blue me now. So we're not dependent on others, to fix this bottleneck. This is really a chokehold, and we must address this Faifal area where pillars where Minister talk about here. Supply blow one file key one workforce. Or training here. So we have to address this ourselves. Let's lift it ourselves. And surely others might come for help MUMI. But on the matters of Cuban doctors, let's not talk as if they are inferior. They are not. They're as good as anybody else. Mm-hmm. And then the registration process law here and internship law here now is for the clinical aspects. And that applies to any doctor who comes from any country's institutions. Applies same law. Thank you, sir.
Thank you. Thank you. Honorable Minister.
Thank you, Chair. Thank you, Opposition Leader. And I really like the emphasis so that people blow me here that doctors from Cuba are equivalently competent as any other graduates from other universities coming in. And in fact, I must thank the MP for his choice for their initiative. Me, but I wonder if there are no initiative to Cuba now, we will have less doctors, but thanks to the previous government for the initiative for Cuba, initiative for study medicine law. Otherwise, this time, I think this whole ratio by me increase for the instead of half by maybe no even to half without a Cuban graduate. So, indeed, I want to report to the House they are very marketable as well to date, and some of them already migrate to other Pacific region. That shows that they are competent as any other graduates from any other university. So thank you, Opposition Leader, for that wonderful remark regarding the Cuban graduate doctors. I thank you, Chair.
Thank you, Honourable Minister. Honourable Chairman PAC and Central Vanera MP.
Thank you now, Small Mala. Thank you so much for giving me that space here. Before I come to our favorite subject, because you picked that one to HIV, it's a real problem. Yeah. I tell you, but I'll come to that one. But DPM, you should call him Minister of Education, may come inside. If he goes to the USB Council Law next council, you tell him, let's upgrade him now. Campus USP lawyer to a fully pledged medical faculty. That was the initial plan, yeah? Yep. That was the initial plan. Yep. Why we downgraded it, me no sabe now. And I have to blame this House. We shouldn't have downgraded the original investment that we want to put in here. If we stick to that plan, we wouldn't be having this problem. And of course, the plan that, is social, yourself and some of us, did in the past to try to push students to Cuba. Me happy now, you lead a blow vision, you stand up and then say, we shouldn't treat them like that. We shouldn't treat them like that. You go to Brazil, the whole Amazonia are all Cuban doctors now, Chidanlo there. Some 3,000 to 4,000 are in the United States. You Milo, I don't know what is it that has made our own people, uninstructed lawyer, to develop in this mindset here, to grade our Cuban doctors like that. I think we need to stop. We need to stop. Some 10 to 15,000. This is the main foreign currency of Cuba. They are medical practitioners, exported throughout the world. Vietnam, in Africa, in South America. So I think we need to change our attitude. Thank you now, Small Malay and Leader of Opposition.
for encouraging us that, we shouldn't treat our students, graduating from there. Some of them graduated with very high gold medalist there, then somehow what happened he passed away there and then came back again, but wasn't able to make it back lawyer. Anyway, that was it. But the Minister of Education, Deputy Prime Minister, you tell him the next USP Council, let us upgrade this USP law here, campus here, to a fully fledged medical faculty. That was the plan that we originally had for it. And you know that, Mr. Speaker, we were part of all those discussions during that time, but then somehow you made downgrading. If we had that, why would we decide to downgrade it? I don't know. You have law faculty in MLS, agriculture faculty law where? Samoa. I think it's just right for Solomon Islands to host the medical faculty. So bring it up again, Minister of Health, talk to the Minister of Education and let's do that. Let me come to HIV. This is a real problem now. Your officials, Minister, reported an increase up to about 70. That is money, 70, and all related to illicit drug use. This is a big problem. Say, at a certain point in time, we have to make a decision. The whole country here, even Honiara, I think Lucine Day by me announcing, Central Honiara must be drug-free. And we are going to engage everyone, report him, anyone caught using all these stupid something here, straight to the police. Yeah. Or even we will take actions ourselves too, go and manhandle him more than Karamoto go and then send them straight there. Yeah, something was saying, yeah? Yeah. So Central Honiara, listen to me. That's our policy. Central Honiara Baraba no good this time. In fact, some of the premises in Chadlo, Central Honiara are being used for all of that. One time we go to one place, look over hip hop, tissue not come out, and all sorts of, Mr. Speaker, Chairman, man, town blue me, but I no good much this time. Minister, what are we going to do? Tell us. Give us some hope that, next year you are going to tackle this head on straight now. What are your plans on it? Thank you, Mr. Chairman.
Thank you, Honourable Minister.
Thank you, Chair. And looking into the future on our HIV control and, of course, elimination, Tammy launched a program blow HIV World AIDS Day. Me really asking people blow me. First time me reading speech blow me written in English, me parat strangle for talk pidgin time for translating on the spot of the statistics that I have. Time PAC report, time executive blow me report, law PAC and what is appeared in the Public Accounts Committee, hem 70 chair, but now it's 79, and just the last week that we reporting, 3 of which water no receiving treatment, and I do make the call, even no debate. Me make them call too for Trifala must come for receiving treatment, come to the health facilities for receiving treatment. Now HIV, I'm one for retrovirus, that very difficult to manage, and well progress on Blohem leads into AIDS, acquired immune deficiency syndrome, in that juncture, Chair, we follow plan for declaring the agency of our consent to tackle HIV. We've been talking with our donor partners, and I must sincerely acknowledge the fact that they voluntarily come out and ask me, how can we help? So HIV team or department within the ministry, this time we will start for Apumna resources there. Like for thank him to the cabinet ministers during allocations lo vea kole imi able for giving one fala. Thank you to you all for the support. Yumi bara need collective effort, the national collective effort from parents, church groups, community leaders, and I essentially thank the MP for Central Honiara for this bold statement that Talem decided for drug-free law constituency. And I do hope that all of us, the 50 members of parliament during Sinidia, we can align with what the MP for Central Honiara have just Talem. In terms of the drug, Chair, me already signed in proclamation on the rules of the methamphetamine, which is the ICE. And then recently, during our debates last week, me fala cabinet also endorsing now amendment plot of fala act. So that's the way forward. I'm very looking forward, maybe first Parliament next year. You mean take them come amending Tamgona Act here, the Drugs and Poisons Act 1941, so that we are able to have, a law, a legal framework that guide us on addressing the risks of having HIV, and at the same time, clinically, we manage the HIV on our part within the ministry, Chair. And I thank you to my member Blow Central Honiara for that point raised. Thank you, Chair.
Thank you, Honourable MP for Small Malaita.
Thank you, Mr. Chairman. Me happy to talk to the Minister and for Central Honiara the talk to this one. Or the statistics here, me here in this time talk to me time me here what number and a real number stability, which is probably even higher because like Staka Sanvios and Kakasi with me, especially this one, people less for report, So even need for Waka, or got Sanvios and or got a song what she singing on radio, what good one, low awareness and also. But actions where Central Honiara like for Tekemena, Minister, you fund them. No go break him house, break him in Kansani where you see me. That one by at some stage you will have to be that aggressive. So kind of the picture and also like or the cigarette packet where you will run you see me. The pictures they are so graphic, but you go smoke them no more. So me no understand so. Central Honiara me agree action now you me by taking Minister you fund them. Question Blomilo page 190. Even though when this time
86, 186.
10 page, 8 pages.
Any page no more?
Yeah.
Okay, thank you, Chair. You mean a little bit run fast. But question Blomem go by why me raising this whole question? Minister time. I think there was a question about consumables below CMC. It's all a new comprehensive medical center. And I think in Talem Sani also, OHEMLO under budget law national medical stores. So me look there now. Budget law there, him go down here, Mr. Chairman. So, but it's an issue for you. You mean like CMC, you may start for taking some responsibility. Him now point him talent, Minister talent, because starving next year over 100 staff by you may need for filling up plus CMC. But this one law consumables, not me like 7, no good budget somewhere yet for funding water consumables. Thank you.
Thank you, Honourable Minister.
Thank you, Chair, and thank you, my good friend, the MP for Small Malaita for raising this one. If you look law code 22202-101-26 drugs and dressing, have reduced, but because of this year. For that budget last year, 2026, where 95 million. Yeah? Hem in fact for refinancing to debts blame contractual supplies. But we also finance almost half of them this year now. So that is why I'm not looking to reduce. And also some of the budget below CMC have captured inside law NRH to chair. If you look at chemicals and also as what PAC chair have done, it's quite fragmented and posted everywhere now over the budget. So this is medicine and dressing. Yumi Garem this year about 40 million contractual supplies debt Yumi. Already half Yumi changed it. So we are comfortable with the extra 20 million we have left under this head. Thank you, Chair.
Thank you, Honourable Leader of Opposition.
Yeah, thank you, sir. Me like come back law NCD mo yeah. And as member below is Choice Talent, it's woven right across the entire budget, of course, the response. Firstly, law Minister of Finance, law side law revenue, because you migarem sugar, salt, something else, oil or something else, and tax, yeah, or butter, not something else. So the tax, yeah. Some discussions over the last few years is to ring fence the revenue that comes in from taxes, long or where contribute long NCD, yeah? And to help in the fight against NCD. Where are we on that? Do we know how much specifically is being raised local taxes here? And so that we know that that money is going to this very important fight. Finance Minister Nahuem, answer tax.
Thank you, Honourable Minister of Finance.
Thank you, Chair. Thank you, Leader Law President for that important question. I think in terms of, especially for really like taking revenue from a particular product like tobacco or cigarette, and then part of receiving, especially for preventing a particular account for financing help. That's not really the case now. And so, like I mentioned during my wind-up law debate, that's the area we are looking now, especially to sort of reviewing that, and of course looking at increasing the exercise duty as well. So yeah, we are now visiting those to see, because as recommendation that these are the critical areas, like you discussed in the health sector, of course, education. So yes, thank you.
Thank you, Honourable Minister. Honourable Leader of Opposition.
Yeah, thank you. I think this is very important. Otherwise, I mean, look also, you meet taxing for the sake of revenue no more. But you meet taxing, then selling it, go back, low health threat for fighting. At some stage, you know, you may got a curve where, if the evidence is showing it, that law food regulations, we would need to come down hard and stop sample imports, look at something where causing, where the marginal cost is just too much. We would never, we don't have data, so we can't make that kind of policy decision. So capturing that data is really critical. But first line of response, not taxing. Okay, mo imit taxing no, but no collect them data and look also taxing or tax no more. Not really in that fight, nor looking at the data to inform policy. At what point do we say, hey, naflo nudul now, no nudul kam lokan, naflo kon beef now? Okay, kind of decisions also. Well, we are going to have to go to that extreme. If 7 out of 10 deaths or presentations came from NCD, how worse does it get before you ban import lo nundul? Nundul sweet to you, but sweet you know, so I mean, how much worse do we want this thing to get before we take really drastic action? It's a really serious policy question, this one. I just don't sense the seriousness in terms of capturing the data, informing policy, and then taking very drastic, decisive action. Look, this one. So I'd like to encourage the Minister of Finance find ways to capture that data, and then see how that correlates with the resources required in this fight against NCD, and then see what else we need to do, including Yumi Banem, or something we're causing people blaming for sick also. Yumi Banem from Tekem Kamlo country. You know the dance around in this matter for a long time. We've been dancing around it for too long now. So, Syed Longo, Minister of Health, Chairman, I'd like to ask no more. So, in terms of NCD, where are we? Am still go up? Am go down? Or am level? Where are we? Thank you.
Thank you, Honourable Minister.
Thank you, Chair. In terms of the trend, him go up until Imi Banim now, something you talk about him, yeah? But I want to contribute by saying that we have an issue of urban food security, the issue of banning those food, yeah? Because of the urbanization that comes, everyone like Lohoniara causing food security Lohoniara. And that is why, Chair, me take an initiative here for food security for Honiara. So, not go recognise him live for food based in Lohoniara. And once I see the food security law, urban centers start for stable, I did some surveys in in central Lohoniara, and as well as law central market, of looking into how na quantity of local kakai coming in, and with the impacts of the 12 tractors, Chair, it's working really quite well now. It's still early to measure the significance of those economic zones in my constituency producing food security for the people of Honiara. Lohomea, no problem here for food security. But in the urban areas where urbanization comes in, food security become an issue. If we bani mot kakayarun ba dialogue hagere than dialogue signicia, Chair. So once we quantify this food security issue, nutrition comes with it, and then we will be able to put some axe on some foods that coming in that continue to be the risk factor of NCD. A single company where they contributed around 250 million, and then if you combine all the NCDs here, per annum, it cost us around 850